Hello, this is Dr. X, a doctor working here today. May I confirm your name and age, please?
My name is Julia Thompson, doctor, and I am 40 years old.
Okay, how may I address you?
Please call me Julia.
Okay, Julia, today we are going to discuss about your health issues. Is that okay?
Okay, doctor.
Okay, during our conversation, I might take down some notes, which will be strictly confidential. Is it all right?
No problem.
Okay, so Julia, can you please tell me in your own terms, own words, what has brought you here today?
Doctor, for the last 2 years, I noticed that I feel some pain in my fingers, and especially sometimes, especially when I exposed to cold and in the winter. At that time, I feel that my hands become blue, and then it becomes red, and in the time, I also feel pain. And some after rewarming in the during the first episodes, after rewarming, uh, they usually went away, but currently this is not going, and I am having some problem with my hand, and also in the main nowadays I even cannot use refrigerator, because even the cold of refrigerator brings that condition. So I am scared of it, doctor.
Okay, you told that I'm very sorry to hear. We are trying to find out the cause behind this. May I know that were you completely well around 2 years back?
Yes, doctor. I didn't have this problem.
Okay. And when it started, did it affect both hands at the same time?
Yes,
Fingers
doctor.
of both hands.
Yes, doctor.
Okay. Okay. And you told that there has been some color changes and also some pain. Can you please tell me that does it involve both hands, this pain?
Yes, doctor.
Okay. And can you remember when the first episode came? Did it come around suddenly, all on a sudden, or gradually?
No, doctor. I told you that first I didn't pay attention to it because I thought that it might be due to cold exposure. But the problem was gradually increasing.
Okay. And when did you first thought that it was a serious issue? Can you please tell me?
That was about 2 years back when I first visited my GP for this condition.
Okay. And so you were telling that it was more or less present before that also. Am I right?
Not no, that was some what negligible. I didn't pay attention to it.
Okay. Okay. And now it's getting much worse. Okay, I get it. Well, can you please tell me that for how long does that persist? This type of the color changes, pain.
Uh, Around half an hour, sometimes more.
Okay. Uh, how many episodes do you usually face now recently?
Doctor, when I exposed to coal, I always feel this,
Always,
because yeah,
always.
initially I thought that it was due to exposure to cold, so I used hand gloves. That helped me a little,
Okay.
but nowadays
Okay.
that isn't helping at all.
Mhm.
And also some, even I told you that I some cold from the refrigerator also triggers this condition.
Okay. Okay. I get it. Well, okay. And can you tell me that whether anything makes you feel better other than rewarming?
No,
Okay. Well, let me ask you some other questions. Well, do you have any headache?
no,
Okay. Any blurring of vision?
no,
Okay. Any soreness in your mouth?
no,
Okay. Any rashes anywhere in the body, in your neck or in your knuckles? Have you ever noticed?
no.
Okay. Can you tell me whether you have any joint pain?
Yes, doctor, that is another issue. I told you that during exposure to cold, I feel the color change, and also I feel the pain in my joints.
Okay. Can you please tell me which joints?
Joints of my hands and also my ankle joint. Ankle joint pain started just about 1 year back, but
Okay.
and pain was for last 2 years.
Okay, hand pain for last 2 years. Yes. Can you please tell me that both pain in the hand or in the ankle are same in nature or different?
I think all of them are same.
Yes. Okay. Well, can you please tell me that whether there is any morning jamming present or not
Yes, doctor.
in your joint?
Sometimes I feel morning jamming.
Can you please tell me for how long does that persist, this jamming?
Maybe half an hour to 1 hour.
Okay. Does it involve both ankle joints in case of ankle or just one single ankle joint?
No, both ankles right.
Both ankle joints. Okay. Do you think that there is anything that makes your joint pain feel better or worse?
Sometimes some during the pain, sometimes some movements makes somewhat feel better.
Okay. I get it. And do you have? Can you please tell me that? Do you have any pain in your back?
No, no pain in my back.
Okay. Any changes in your nail?
No,
Okay, that's all right. Can you please tell me that whether there is any weakness in any parts of your body?
no.
Okay, any tingling or numbness in any parts of your body?
Yes, doctor. There are some numbness along my joint.
Which joints? Can you please mention?
Especially more on it's on the right hand more, but sometimes present on also left hand, and I think it is on my outside of the hand.
Okay, you feel that it's more on the outside of the hand. Okay, that's all right. Uh, okay, and when did it first started? Can you please tell me?
About 6 months ago.
Okay, okay, around 6 months ago. Well, do
I
you,
visited
okay,
my GP and I visited my GP. He gave a pregabalin for it. That helped me a little.
okay. Can you please tell me that did it come along slowly or gradually or suddenly?
Gradually.
Gradually. Okay. And do you ever have to wake up at night for this pain
Yes,
or for this tingling
yes,
and numbness?
at night, sometimes I have to wake up and I feel the tingling, and then I need to shake my hands.
You have to shake. Okay. Can you please tell me for how long do you have to do it?
For shaking my hands, it may take 5 to 10 minutes to receive pain.
Okay. And for how long does that tingling persist?
I cannot tell you exactly.
Okay. 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 And can you tell me how frequent these episodes have become recently? Has it been same or has it increased or decreased?
It's increasing in
It's
severity.
increased. Okay. Increasing in severity. Okay. And okay. And do you think that there is anything that makes you feel fitter, better other than this shaking?
No,
Anything that makes it worse?
uh, some washing clothes, and also
Okay.
some times keeping my hands in a fixed position.
Okay, okay, I get it. Keeping okay, and in fifth position. Okay, can you please tell me that do you have any weather preferences recently?
No, no,
Okay, any changes in your weight?
no,
Okay, any may I? It's a personal question. Any changes in your menses? Have you noticed?
no,
Okay, and okay, and well, do you think that there is any increase in size of your shoes recently?
no,
Any increased sweating?
no.
Okay, and okay, and may I ask you some other questions? That do you feel any chest pain?
No such pain, doctor, but I feel some shortness of breath, and this wasn't present previously. For last few months,
Uh,
I noticed that I cannot walk like before, because after walking for about 100 meter makes me feel shortness of breath.
okay, okay. And do you okay? And do you have to use some extra pillows at night for this shortness of breath now?
No,
Okay. Any swelling in your legs?
no,
Okay. You told that some that what makes it worse other than this exercise is anything more?
no.
Is anything else?
I don't know.
Okay, and anything makes you feel better?
Taking some rest make better. Nothing. I cannot tell you anything.
Okay, okay, that's all right. That's all right. Any racing and pacing of your heart?
No,
Okay. Any chest tightness?
no,
Any difficulty in swallowing?
no,
Any difficulty in speech?
no,
Okay. Any noisy chest?
no.
Okay. Can you please tell me what about your water work? Has it been all right?
Yes,
Okay. And your bowel movement?
fine.
Okay. And your bowel movement fine. Well, can you please and tell me some other questions? Are you on any? It's a personal question actually. Are you on any pill? Can you please tell me for your mm, mm, personal life or conjugal life?
No.
Okay, and you told your period was normal. May I please tell me? There's again a personal question. That have you ever been pregnant?
Yes, doctor. I have two children.
Okay, any and they're all right.
Yes, doctor.
And any history of pregnancy loss?
No,
Okay, that's very good. And any complications in previous pregnancies?
no,
Okay, okay, and okay. Mm, and well, can you please tell me that do you feel that there is any dryness in your mouth or in your eyes?
no,
Okay, and do you ever have any problem with in your any clotting abnormalities or any clotting problems,
no,
blood clots?
no. I don't know.
Okay, and okay, and well, that's another personal question. Can you please tell me that do you have any any soreness in your private parts?
No,
Okay, and and okay, and okay, and can you you haven't okay, and can you tell me that does anybody in your family have such similar type of problems?
no,
Okay, and hmm, uh, may I ask you some personal questions? Do you smoke?
no,
Okay, do you drink alcohol?
no,
Okay, any over the counter any recreational medication?
no.
Okay, any drugs that you take regularly?
Yes, doctor. I have
Can I know it?
I have depression. For that, I take escitalopram daily for the last 3 months. 2 minutes remaining.
Okay, okay. Any changes in the dose of
No,
escitalopram?
no,
Okay, and okay, and any allergy to any medication?
no,
Any over the counter medication?
no,
Any herbal medication?
no.
May I know what your job is?
I'm a school teacher.
School teacher. Okay. Okay. And do you feel any difficulties now while teaching with your hands?
Yes, doctor. I needed to take frequent leave due to this issue.
Frequently due to these issues. Okay. Okay. That's a difficult thing for you. Okay. We are going to involve the social services and occupational services so that they can map out a plan for you. Okay. Is that okay?
Okay, doctor.
Okay. And can you please tell me that whom do you live with?
I live with my husband, Alcinder.
Okay, and may I just, that's another personal question, but I have to ask it. Do you have any casual relationship other than your husband?
No, never.
Okay, that's all right. And may I know that are you well supported economically and as a family?
Yes, doctor.
Okay, and may I know what your concerns are, Julia?
Yes, doctor. Why I am having this problem?
Okay, okay, that's all right. And well, I can tell you for sure after actually examining you properly and also assessing you. But well, at this moment, mm, May I ask you some other questions? That did you have any recent travel history?
No.
Okay, that's at this moment it's at first I have to examine you properly and also assess you, and then I can be sure for sure. But at this moment, I think that
Time is up,
that you're okay.
but you can continue.
Hmm?
You can continue.
Okay. But at this moment, as far as I have taken your history, I think that it is actually, it may be due to a problem called Reynolds phenomenon. Okay. So Reynolds phenomenon, don't bother about the term. It can occur due to some uh, some problem in your vessels in the hands. Okay. So don't bother about it at this moment. But this can be caused by various reasons, or sometimes there can be no cause at all. Okay. So we are going to run some blood tests, and also some blood tests for this, and also we might be doing some scanning tests since you told about some shortness of breath. So we are going to find out that what is the cause of this. Okay. And yeah, and since you have also told about uh, some um, some pain, some tingling and numbness in your outer side of the hand, it might be related to um, a syndrome called carpal tunnel syndrome, and carpal tunnel syndrome, and don't bother about it also. But we are so this can also be caused by some other reasons. So we will run the tests and they'll try to find out that what is the cause behind it. We will involve the joint doctor and also our consultant, and as soon as we get the results, we will get you. Are you getting me, Julia?
Okay, doctor.
Any more concerns?
Are you going to give any medication now?
Just right at this moment, actually, I'm going to assess you properly and run all the tests. And after making the proper diagnosis, I think it will be better if we start the medication.
Okay, doctor. Thank you.
Okay. Any more concerns?
No, doctor. Thank you.
Okay.
So, present your case.
Yeah. So I think the patient, the patient, Miss Julia, she has been suffering from pain on hands on exposure to cold for the last 2 years. There is also some associated color changes, which turns blue, then red. And at the beginning, it was just only to cold exposure, but recently, even she cannot handle the refrigerators also. And also there is some pain associated, which is more likely to be inflammatory in nature and involves the ankle joint as well. And although there is no other although there are no other features of seronegative arthritis, but okay, and seronegative arthritis, and moreover, she is also having some tingling and numbness in her right hand, and both left hand, but more in the right hand, and which is more for the last 6 months. And she is also suffering from a shortness of breath, although it is not associated with any nocturnal dyspnea, and nocturnal dyspnea or any leg swelling or any racing and pacing or anything or anything else. So since she has some inflammatory type of joint pain in her hand, both in the ankle, and also she has some tingling and numbness in right hand, in both hands, but in the outer side. So I think that I would go for the combined diagnosis of uh, Raynaud's phenomenon and uh, carpal tunnel syndrome associated with rheumatoid arthritis.
Any other differential do you have?
Well, any other differentials? Okay, I just it might be due to systemic sclerosis, but I couldn't elicit more symptoms for this.
Okay.
But actually, I also missed some points. I didn't ask about skin tightening or any difficulty in opening the mouth. Although I asked about dysphagia, difficulty in swallowing or difficulty in bowel movements.
Okay, how
And
did you
actually,
get her?
okay. First of all, I will go for some routine blood test, and then also some inflammatory markers like ESR, CRP, and then I will go for autoimmune profiling, including ANA and also ANA and also our rheumatoid factor and HLA-B27, all these things, and then I will go for some scanning tests like HRCT, high resolution CT scan, pulmonary function tests. And for and I will also consult the nerve doctor and joint doctor, and they may perform nerve conduction study for finding out the cause of the hand pain, tingling and numbness in the hand.
Okay, suppose this is a case of systemic sclerosis. How will you manage
Yeah.
it?
Okay. First of all, if you go to the hand symptoms, then first of all, if you go to the hand symptoms, I will have to advise her not to go to the cold, and also if there is any exposure to cold, to use hand gloves, and also I might I have to involve the joint doctor to find out whether any vasodilator like calcium channel and antagonist nifedipine can be used, or any iloprost or any IV vasodilators can be used in this case. And also okay, and also I will have to find out his blood pressure, and also I also have to check the serum creatinine and urea electrolytes and routine urine microscopic examination to find out about this renal function. If there is any type of hypertension or scleroderma renal crisis, I think then I will have to prescribe her ACE inhibitor to control that. And also I will have to find out the cause of a shortness of breath, whether there is any restrictive lung defect or not. If that is present, I might have to go for a steroid.
Okay, thank you.
Thank you.
Okay, I'm coming to the points. That is for history taking. Patient's complaint was pain. One exposure to cold. So for pain in hands. You have asked about sight. Then onset.
I just yeah.
Which joints? Can you show me the joints? Was this single joints or small joints or large joints? And how many joints? That's important. Okay. Then onset. Then character. For character of pain. Here hand pain is not so important, but character of something, that is characteristics of inflammation is present or not. You should always ask for this, for a pain in joints or any musculoskeletal pain. That is signs of inflammation, that is pain, redness, swelling, increased temperature, and functional impairment. I think you haven't asked all of this.
Yes.
Then radiation, then associated symptoms, any sensory signs. Any changes in the sensation for any pain, any changes in the sensation. Okay. And yes, and pain on hands bring us a few possibilities like rheumatoid, rheumatological conditions. So for rheumatological condition screening, you should have asked more thoroughly, so you could get any rash.
Yes, I asked it. Okay.
Yes, you asked any rash, any joint pain, any other joint pain. Then any lumps or bumps. Okay. Then also for systemic sclerosis, you could have come at this point or come later for that.
Okay. Yeah.
Then for associated symptoms, then there are other associated symptoms, and also she said that she has some changes in the color due to exposure to cold. So at the time you should take elaborate history on that. What do you mean by change color? When it start? How long it persist? How does it disappear? Does it went on its own? Have you ever uh, been ulceration on the fingertip area? Okay.
Hmm.
And after that, let's set it, and then timing. Was there any timing which brings this or not, brings the pain or not, without if the hand pain, joints pain are present without changing in the color. Okay, there was three types of pain. That is, one pain was associated with changes in color, other pain was inflammatory type of pain, and other pain you haven't asked about that. That was large joint pain, that is ankle pain. There was no signs of inflammation, just pain. Okay.
But I actually asked that whether it was same in hand or ankle. So the patient told that it was same.
I cannot remember. Okay, character
Yeah,
was
yeah,
same,
yeah.
character was same, but you haven't asked about swelling, redness. In the ankle joint,
Okay,
there was
okay,
no
yeah, yeah.
swelling and redness.
Yes.
And eliciting factor, aggravating factor, then severity. How much severity was?
Yeah, yeah, yeah.
It was very severe that hamper his daily life. Sorry, hamper her daily life. Okay. Then in the on the history taking of pain, you could have come to a diagnosis that was it any rheumatological condition and which rheumatological condition, and after that you should ask about all the differentials or all the complications point. And it was a case of systemic sclerosis, because Raynaud's phenomena is most likely associated with systemic sclerosis. Always can be associated with other rheumatological condition, but here associated with systemic sclerosis. And for this patient, that is 40 years, lasting with pain, and also for a prolonged duration with mild cold temperature brings the pain. So there is likely possibility of having some underlying condition or secondary Raynaud's phenomena. Okay, after that systemic query you have asked it, and in the past history you have asked it, and also she has another complaint. You went that well, that she has history of carpal tunnel syndrome. That is also another complication that may
What?
complication due to rheumatological condition.
Okay, what complication I had to ask?
Any rheumatological disease can complicate with systemic, and sometimes can present with vasculitis, neuritis. That is the complication of rheumatological condition.
কার্পাল টানেল সিনড্রোমের সাথে কি সিস্টেমিক স্ক্লেরোসিসের রিলেশনটা আছে, মানে ভেরি আনলাইকলি না?
তারপরে in the drug history you haven't asked about all the drugs I am taking. You could have asked about the drug list, then you are not systemic in the drug history. Okay,
he told about only
you
one
are
drug.
not systemic. You asked about drug history at a very late stage after asking the personal question. Family history, well, personal history, that was fine. You haven't asked about driving.
Yeah.
That is fine. There were primary diagnosis was Raynaud's phenomena, that can be primary Raynaud's phenomena, though unlikely secondary Raynaud's phenomena, that can be due to systemic sclerosis, rheumatoid arthritis, mixed connective tissue disorder. This patient has history of indigestion. You haven't asked about that, so I didn't tell you.
Okay.
And shortness of breath can be due to pulmonary hypertension, can be due to what is called pulmonary fibrosis.
Mm-hmm.
Okay, bye.
Okay.